Director of Programs and Outreach for the LGBT Elder Initiative. And our program today is part of our Doctors In series. I know some of you have been to other Doctors In programs we've done, also some new folks here, so welcome to all of you. The Doctors In is a collaboration between the LGBT Elder Initiative and Jefferson, specifically the Jefferson Center for Urban Health and the Jefferson Department of Family and Community Medicine, which houses the Division of Geriatrics and Palliative Care. And so we do these Doctors In programs each month looking at a different health issue that is relevant to members of our communities as folks get older. Really to hopefully provide information on how you can make healthy lifestyle changes, but also to be aware of certain risks, factors of when you should talk to your doctor about certain things. We've been doing this for about 1.5 years now, and always are excited to see you all and hear your thoughts, your feedback. When we do the evaluations at the end, we love seeing your feedback on what other health topics you want to learn more about, because that's really the information we use as we put together our programming and look forward to what we want to talk about in 2020 with some of these programs. So leading our presentation today is Dr. Jillian Love, who is a fellow geriatrics or palliative care? Geriatrics fellow within the Department of Family and Community Medicine here at Jefferson.
So thank you all for coming. I know it's freezing outside, but this is a really important discussion for, I think, really everyone. And so I've prepared a few slides to go through loneliness and kind of talk about it in general, but I'm really hoping that we can all have a collaborative conversation about this topic and how it may affect us or people that we love or people that we care about, and really go from there. So to start off, I was hoping to just kind of get some ideas of thoughts people have about loneliness and any correlation you might think if loneliness affects health in general. Is this something that people have thought about? Is this something that people haven't really thought about?
There have been recent reports that say loneliness is just as bad as 15 cigarettes a day and obesity.
Yes. So there has been a lot of research going on for a little bit, but especially I feel like in 2019 and 2018 about loneliness and health.
Well, I kind of read that also, or heard it, and it kind of said doing nothing. It was like sitting on the couch watching TV all day is equal now to smoking. Which doesn't make sense.
So loneliness might be as bad for your health as being sedentary or not being active or as smoking. Anyone else have any thoughts on loneliness? Yes?
Well, it's more isolation and a connection with dementia.
And that's a huge one that we see specifically in geriatrics. So the comment was loneliness and social isolation and the link with dementia. And you actually hit on a really great point that I'm going to talk about, kind of loneliness versus social isolation and how those are interconnected. Anyone else? Yes.
I guess you would basically classify me as an extrovert. But 4.5 years ago, I was hit with an inner ear infection, which left me permanently severe vertigo, which has restricted a lot of. I was in high anxiety just coming here today, just being around too many people, or get a microphone and it was too loud, I would have to leave. So I've been socially restricted against my will.
Right, and number one, thank you for coming.
Yeah.
And number two, that's another great point about how medical conditions can really affect our social lives and how that can play a role in social isolation or loneliness as well. Yes?
Yeah, I'm also worried about people who are lonely and the rise, I think, also of suicides. There must be a connection. And if it isn't addressed, people start thinking of committing suicide or other damage and stuff. That's really disturbing to me.
So thinking about loneliness and a sort of relationship with people taking their own lives. Yeah. So these are all great points, and I think we'll touch on almost every one of them during these slides. If at any point you have any questions or comments, just shout them out. So to begin, like I said, this is mostly a conversation, but I did break down kind of exactly what we will be addressing. The first thing we'll be talking about the prevalence of loneliness and how common it really is, and how this is something that I think we really do need to be talking about because it affects so many of us. What exactly is loneliness? I think it's something that we've probably all felt at one time or another, but how does kind of the research and literature define it, and kind of breaking it into different subgroups like social isolation, and kind of talking about different definitions. What are risks to becoming lonely? So we do know that there are some things that could put you at a higher risk of becoming lonely. And then what are the risks or kind of consequences that are associated with being lonely? While loneliness may not cause these outcomes, we do know that there is some sort of correlation or link with them. And then specifically, because of course I'm in geriatrics, had to talk about loneliness in older adults because this is becoming an increasingly common issue in our nation and world. And then I think most importantly is what can we do to really improve loneliness, not only for ourselves, but also for those around us. So these are some pictures of some cute animals who are lonely, because I just wanted to take a moment to pause and say that I recognize that this can be a very heavy topic and might be triggering for some people. And if at any point you need a break or would like to leave, please do so and do whatever you need. This is a safe space and we're all just here to talk about this together. In an attempt to make it a little less heavy, I have scattered some cute animal pictures throughout it of animals who are not lonely. So first, to talk about the prevalence. In short, the prevalence of loneliness is increasing. So in the 1970s, it was estimated that about 11 to 17% of the population classified themselves as lonely. But now it's actually up to 40% of middle-aged adults. There was a study that was done actually across the world in New Zealand that showed that a third of the population who were over age 15 had felt lonely just in the last month. So not only is this common throughout, but it's also something that seems to be happening pretty frequently. In the United Kingdom, some areas of the population screened positive for loneliness up to 45%. So that's almost half of the people that they asked were feeling lonely. 5% of those people reported that they felt lonely often. At this point, I wanted to just take a moment to recognize that being alone is not the same as feeling lonely.
Right.
And those are two different and very important things to talk about. And so I just put some quotes up through from some of the articles that I read. To be honest, I read way too many articles to talk about for this talk, but it's a really interesting topic, and so I just wanted to put a couple quotes up that stuck with me. So the first is, loneliness corresponds to a discrepancy between an individual's preferred and actual social relations. So, if you prefer to be alone, that does not equate to feeling lonely. Feeling alone or lonely does not necessarily mean being alone, nor does being alone necessarily mean feeling lonely. One can feel lonely in a crowd or in a marriage. One may enjoy being alone at times in order to reach personal growth experiences, or simply to take a temporary break from dealing with the demands of modern life. So again, these are all just quotes from the studies that I read, really reiterating the difference between being alone and feeling lonely. Which leads me to really kind of us as humans tend to be social creatures. And this was a quote that stuck out with me. Loneliness emphasizes the fact that social species require not simply the presence of others, but also the presence of significant others whom they can trust. The physical presence of significant others in one's social environment is not a sufficient condition. One needs to feel connected to significant others to not feel lonely. And I think this also made me think about how, there are lots of different spectrums of being an extrovert or being an introvert or being really outgoing or being more shy. And those things don't equate to loneliness, and being an introvert or feeling more shy in a crowd, that's not what we're talking about. Really, when we're talking about feeling lonely, we're talking about not feeling that important connection with 1 or 10 other people around us. So in going through all of the research, like I mentioned, there were lots of different ways to talk about loneliness, but one of the main categories was really to break loneliness down into 2 different areas, and that was lack of companionship and social isolation. So when we think of social isolation, we think of being physically not around other people, being kind of physically isolated. Whereas lack of companionship, we think of you may be surrounded by people. Right now, we're not socially isolated, all being in this room together, but we may not feel that connection of that companionship with someone else in the room where we are. The research also talked about defining loneliness kind of in different dimensions, and I get that this may be a little too philosophical, but I just found it really interesting, so I wanted to include it because I think in thinking about loneliness in different ways, that may help us be able to improve our own loneliness or loneliness of people around us. So the first dimension was labeled intimate loneliness, also relational loneliness, and then finally collective loneliness. And in thinking about these 3 different dimensions of loneliness, we think of intimate loneliness really as that intimate space around us with a few people with whom we are the closest and can really trust and rely upon. Relational loneliness is more of a social space. So this is more of a group of friends, a group of close support network, whom you could reach out to if you needed to, but might not do that every day. And then collective loneliness is really a public space, and that's a much kind of broader dimension, an area in which you can still feel lonely. Other ways of describing this for intimate loneliness, kind of comparing it to emotional loneliness. And the easiest one would be thinking of a significant other, but again, it doesn't just need to be a romantic partner, it can really be someone who is significant in your life. Relational loneliness is thought to be more of as a social loneliness, so this might be groups of friends if you're feeling less connected, less able to interact with friends who previously gave you a social network, also known as your sympathy group. Uh-oh. Do you mind? Sorry, not used to clickers. Yes.
I kind of hear a common denominator when you talk about trust, in order to have relationships to relieve the loneliness.
Mm-hmm.
But the trust is the part that takes the time that at this point a lot of people don't have. And I think a lot of people like me have lost a lot of people that they did trust and felt secure with and friendly with enough to be significant in their lives. So when that happens, you're back to square one. And I don't see how any of this relates to creating that kind of a relationship at the late point.
Right.
Does that make sense?
It does, and I think that's a really important point. So just for this side of the room, sounds like losing the trust in someone is then sort of breaking that trust and significant relationship, and how maybe that is isolating or could feel lonely when that trust is broken. Would you say that summarizes?
Well, I'm saying that the people that you trusted are gone. So now, in order to relieve the loneliness, you need somebody to trust, but the people that you trusted, it took a long time to get to the place where you trust them, and now you don't have that time. That's basically what I'm saying. So I'm not sure how you would get back to trusting people.
I think that's a really tough spot.
Well, that's why I'm here.
Yeah. I think, I am by no means an expert, and I think we could open this up for conversation. I think that it speaks to kind of what I was saying with the different dimensions, that maybe if you find one or two people who you feel open with or connected enough with to try to pursue that level of trust and that friendship, relationship, whatever that is, that I think one thing that I learned by organizing this presentation is that you really don't need many people. And so you may be able to really establish one of those trusting relationships with just one person, and that may kind of help give you that connection. Maybe.
Thank you.
And so that would kind of be more of the intimate loneliness, the loss of those significant relationships. And then going back out to the bigger picture is the collective loneliness. And that's really your entire active social network. Did you have a comment?
Yeah, I wanted to make a comment on the intimate loneliness. Like, I find myself being very lonely when I'm with my family and my partners, because I think it came from like abandonment and understanding me as a gay person, having that conversation. I became, very closeted and very close and stuff, and then folks would always tell me that I'd never have a partner because I'm gay. And I'd be alone the rest of my life because I'm gay, and I believed it because it came from these strong voices like family and stuff. So when I'm with the family and like partners, I always feel like I'm gonna lose that person, so I don't wanna trust them. And then I get anxiety because I'm like, because I became so addicted to loneliness. So that's the thing, and that's why I became addicted to my loneliness. So breaking that thing was the hardest thing for me to do. Like I could go out, be amongst a million people, seem to be having a good time, but I'm still like, I don't want to be seen. I don't want my scars to be seen. I figured like I was a show, you can see all my scars and stuff. So I try my best to just stay in my lane. And I have to do a lot of work over the past 10 years. I'm 40. It took me 30 years to get to therapy to deal with my mental and emotional problems. And most of it stemmed from loneliness and abandonment. But today I'm thriving through it all. I'm getting better at it, and I try to just understand, to teach myself and know that I am who I am, and it is what it is. And I love me first.
It's good you're here.
I'm happy to be here.
Yeah.
What was that?
So I'll try to do it justice. We were asking, not everyone over here could hear you, but it sounds like loneliness had been something that you had dealt with for a long time, and kind of coming to terms with who you were and others accepting or not accepting who you were. It was maybe easier to be by yourself?
Well, I just didn't know how to trust anyone. I didn't want to put myself out there to have that same, that scar be poked out again. So I just tried to stay myself instead of giving my partners and stuff. I always would sabotage my relationship because I just didn't trust the longevity of it. I felt more comfortable being alone. And it's like you want a partner, but you're afraid of the commitment.
Right.
Does that make sense?
Thank you for sharing.
Yeah.
Yes.
Another part of what you have written up there also could be loneliness if you've been with someone for a long time and they die. And so then you say to yourself, you had a lot of trust and you had a pretty good relationship, and then you don't have it anymore. And then you're older, because when you had possibly I was with my partner for 21 years, so you're much younger than when you met, and then you're much older when they pass away. So everything changes. Your you know, the whole attraction to people, or people that would be attracted to you when it comes to age and so forth, then it becomes an age type thing.
Mm-hmm.
So I think that is part of the loneliness of someone that has gotten used to having someone.
Yes. And again, it's that loss of, that would be kind of classified as the intimate loneliness, that person who was your go-to person for that many years, now you don't have that support in that really close dimension.
Different.
Right. I'm sorry?
I was thinking it's kind of a different version of what I was saying.
Right. And I think already we can see some common themes that are coming out from different people's experiences, and I think that's one of the main things that I'm hoping to kind of talk about during this talk, that this really is such a prevalent issue.
Can I say one thing? I
Sure.
just thought too, I was the only one in my loneliness. I never thought that people around me were suffering from the same loneliness. I just thought I was the only one. So when I migrated and came to America and I saw like real life, and I became a part of support groups and stuff, I felt like I have a community now. You guys could understand me. I'm not here in this cuckoo by myself. I could open up and share my story. And through sharing is healing. You know, I've gotten better at it because I always thought I was the only one living in silence and loneliness and stuff until I had to like realize, hey, it's not just me. So let me.
Mm-hmm. Yeah. It can be almost double hard to feel alone when dealing with loneliness.
Yes. Yeah. Because I was alone and lonely.
Right.
It's like a double whammy.
Mm-hmm. This picture is a little blurry, but again, it's just a picture to kind of represent the last couple of slides, showing that very close personal space and then your relational space and your collective space. The N is just the number of people that one group of researchers said maybe could be in each circle. So you can see that personal, intimate space is really just a few very close people to you. And then the numbers quickly expand as you get farther out from your really closely knit circle. So now we've talked about all definitions of loneliness. Here is a dog and an elephant not being lonely. And I think this is Mabel the orangutan and Roscoe the dog, keeping each other company. So now that we talked about kind of what loneliness is and different ways of defining it, kind of who is at risk of being lonely, and we've already touched on a couple of those points. Specifically, marginalized population. So any group of marginalized people is at a higher risk of feeling lonely. Living alone. You know, we talked about being alone and feeling alone, so that's social isolation. While being alone doesn't always make you feel lonely, it does put you at a higher risk of feeling lonely. Not working outside of the home is kind of similar to living alone, so not everyone who doesn't work outside of the home feels lonely, but if you're not kind of getting out of the house, of the apartment, you're not meeting those people who might be a social support or network for you. People with long-term health conditions, people with mental health conditions, both of these can be barriers to getting out and having social connections. This was just something nerdy and interesting that I found that I wanted to include. So in medicine, we talk a lot about genetics and the role that inheritance can play in diseases, whether it be physical medical conditions or mental health conditions like anxiety and depression. I think in medicine, we're learning that more and more things are genetically linked. And some studies actually showed that there may be a genetic link to putting you at a higher risk of feeling lonely. And so what the study said was that individuals who are not prone genetically to feeling lonely may, for example, suffer much less from social isolation, while others feel lonely even though they are surrounded and part of a rich social life. So there isn't one specific gene that we know that makes you feel lonely or not, but there may be something in your genes that could put you at a higher risk of feeling lonely, based on your, or also kind of with your social environment.
I have a question. Is there a difference between male lonely people and female lonely people? Are these figures just generally for everyone, or do females feel any different than males?
So this study did not look specifically at men or women. The question was men and women and loneliness, kind of what's the relationship there. But there have been studies that show that women are at a higher risk of feeling lonely.
Higher risk.
Mm-hmm.
Yeah.
Or that I should say, in studies that have been done, women report feeling lonely more often than men. A higher prevalence.
And that could be because the men don't want to say it.
Mm-hmm. Exactly. You said it, not me.
I like that up too.
Yeah, and again, it goes back to not wanting to maybe talk about things that make us feel vulnerable or that we're not comfortable with. So specifically, older adults are at a much higher risk of feeling lonely. So older adults are at a risk of both social isolation, so kind of being alone without that network of people, and for feeling lonely. This is due to a variety of different reasons, but functional and sensory losses are two that, at least in medicine, we always like to ask our older patients about, because if you are having functional losses, such as inability to get out there and to walk or drive, you're going to just automatically be a little more socially isolated. Sensory losses could be things like hearing or vision, could make it more difficult to be in a group of people and talk and hear them and participate in conversations, or vision losses could make it more difficult to leave your house again. Retirement, so we mentioned people who aren't leaving the home to work are at a higher risk of feeling lonely, and I don't know for sure, but I'm guessing that that is linked to why retirement puts you at a higher risk of feeling lonely. You're used to not only a daily habit and routine and seeing people at work, but you're also now having your days really to yourself to do whatever you want. Caregiver stress is another thing. So yes.
Did they talk anything about how social media impacts social isolation and loneliness?
Yeah, so we're going to get to that a little later, if that's all right. But it's a really important topic that I'm glad you brought up, because I think it's one of the most important things that we can talk about today. Caregiver stress is another one that, as we get older, whether it be a spouse, a family member, you're going to, some people are going to be caregivers. We know that almost 1 in 3 Americans is a caregiver at some point in their lives right now. And so that can add its own level of stress and its own level of loneliness or isolation if you are really providing the care for someone and not able to do as much for yourself as you previously were. Death of friends or loved ones is a huge part of loneliness in older adults. We talk about getting older and how in medicine we have all of these things that can help us live older and longer. But the flip side of that is that not everyone can live older, and the longer you live, we may not see our friends live quite as long. And so that's kind of a whole nother realm of loneliness. It's not only that loss of physical contact, but also that loss of that emotional friendship and connection. So specifically older adults in the US, 28%, so almost 1 in 3 adults, older adults, so this is over age 65, live alone in the US. So that's almost 14 million people. But of these almost 14 million people, many of them don't feel alone or socially isolated. On the flip side, many people feel lonely despite being surrounded by family and friends. So again, this is just kind of reiterating that being alone does not equate to feeling lonely, and feeling lonely does not equate to being alone. So just this year in March, University of Michigan put out a poll on healthy aging, and so they asked 2,000 Americans aged 50 to 80 to answer a whole bunch of survey questions. specifically looking at loneliness and how these people felt. They looked at loneliness in regards to lack of companionship and social isolation. Of those 2,000 people, 34% of them felt a lack of companionship, and 27% felt isolated. So it also then asked these people, so number one, they asked them about loneliness and social isolation, and then they also asked them how they felt their health was doing. And people who reported that they felt lonely were more likely to self-rate their health as fair or poor rather than well or good. And these trends were found not only in physical health, but also mental health. And specifically hearing as well, which again, we talked about how hearing is a really important part of being social, and that feeling lonely can lead you to feel worse about your physical and mental health. It also looked specifically at long-term loneliness and saw that long-term loneliness is correlated with memory problems and also actually life expectancy. I'm not throwing all these graphics out to scare people for being lonely, but again, just to reiterate the importance of really talking about loneliness and all of the different correlations that we found with significant outcomes. So these are a variety of different medical issues that have been linked to loneliness. Again, loneliness does not cause these. If you are feeling lonely, it does not mean that you are going to have high blood pressure and heart disease, but we've seen trends throughout the studies. And so these correlations include high blood pressure, heart disease, obesity, weakened immune systems, depression and anxiety, memory problems, alcoholism, suicidal thoughts like someone mentioned, impulsivity, decreased sleep, inflammation within the body, and increased death. That was a lot. That's an owl, in case you can kind of blend into the sofa. Uh-huh. Giraffes are my favorite animal, so I had to include this one. So now we're kind of really getting into how do we fix it. Does anyone have any questions on anything specific?
My question is, every time I see these statistics, I just wonder why. I mean, you say 27% do this and 27% are lonely, but you don't say why or what led these people, to do this. It's just like knowing the number, but you don't know what caused a lot of this.
Right.
And that seems to just be knowing numbers and not knowing, it doesn't really help to me.
Yeah. And that's a great point. And one of the things about statistics, we can throw out all the numbers, but if we don't know what's causing it, how are we going to be able to fix it? And I think, even within this room and amongst ourselves, we might not be able to identify exactly what is making us feel lonely, but we know that we're feeling it. But we do know that different things put you at a higher risk of feeling lonely, like being at home or maybe living alone. And so while I can't say for sure that those things that we talked about cause loneliness, we know that they can contribute to it.
I was doing surveys and this, that people are going to be reluctant to really, if they even know. But as you said before, men in particular would hate, you say you're feeling lonely and you come out there, you're kind of, it's not, it's kind of an individualistic society, so the idea is to rough individuals, men go up here to be rough individuals, that we don't need anybody, we kind of have that thing, and that's the myth. And it's hard to, I feel lonely, and wait a minute, you're a man, you're not supposed to feel these kind of things. That's that old patriarchal thing. So people are reluctant to even kind of say these things, and that's, I think, the problem is, and they may say to their therapist or maybe someone, but to say it in public is kind of, they kind of feel, I don't know. It's just like any kind of survey. Sometimes you kind of you answer a survey the way you think the person wants to answer, but not necessarily telling the truth. And that's what hurts finding remedies, I think.
Yes. Thank you. Sorry, I keep fidgeting with the clicker. But you bring up a great point, and I think that that point reiterates the fact that these numbers are probably higher than we are even reporting right now. So we're saying in the US about 40%. It could be double that if only half of people are willing to admit on a survey that they feel lonely. We really just don't know because there's no lab test that we can do. It's really just, are people willing to talk about it?
Yes, the young man back there said something that resonated with me. When I was young, I'm a boy, I was born biologically a boy, but I don't do boy things. Never did. Didn't care to push trucks or lift heavy things. I like Barbie, you know. And I was told that boys don't play with toys like girls do. And I was like, well, that's what I like. Just like allow me to play with these things. But they would tell me, no, you can't do it. And then because I was not allowed to do what I wanted to do and had to do the thing that they told me to do, loneliness came because they was understanding me. You know, so I became that, I think that's where it started, by not accepting the things or the person that I was. I'm being forced into doing the things that I cannot be great at. You know, so it added to that. I think that's where the genesis of my loneliness started. And I became so accustomed to being lonely, it just became a thing. You know, I expected it, you know, loneliness to happen all the time. So thank you for saying that, because I never understood why parents have to tell their kids. I think that's a big fear of most parents have, because you don't tell a child who they should be. Ask them what they would like to become, you know. And I just never had that option to tell my parents, like, I like these things, because I didn't have like the words with my feelings. I knew I was gay, but I didn't have the language to go with my emotions. But being the parents, they should have figured it out and say, okay, my child is not the child that I want it to be, but it's who he is. Let's go with that. You know? So this added to my loneliness. And so thank you for bringing that up, sir. What's your name?
Eric.
Eric, I'm Garvin, Eric. Nice to meet you.
Thank you all for sharing.
So I just want to say on that too, and thank you for sharing that, but I think it is something specifically looking at LGBT communities that many people have had similar experiences of maybe not feeling understood by their families, or maybe losing some of those relationships with their families. That those are all things that can also contribute to feelings of loneliness and to some of that isolation. So thanks for bringing that up, Jim.
What is pharmacotherapy? What is that?
I'll tell you in just a moment. No. So this slide is kind of, you know, we've talked about loneliness, we've talked about the bad or negative impacts that it can have on our health. So really, what can we do about it going forward? So number one, we need to identify loneliness. We need to recognize that we're feeling lonely and maybe think about why we're feeling lonely and what's contributing to that. There are interventions that we can all do to help improve our loneliness. And then I put pharmacotherapy, so that's the technical name for medicines. Right now, there is no medicine that is a doctor will give you for feeling lonely. But there have been some studies, because loneliness can be linked with depression or anxiety, that if you feel like your mood is affected because of your loneliness, I put pharmacotherapy up there because I would urge you to talk to your doctor about medications that could help with those things. So the first thing is identifying loneliness. So loneliness is not the same as depression. Those are two different things. But research has shown that the two are very highly correlated. So while we can't say that loneliness and depression are the same thing, that loneliness causes depression or depression causes loneliness, we know there is a pretty strong link between them. And loneliness does increase our risk for developing depression. The second thing is really kind of figuring out why we're feeling lonely. So again, you know, we've talked about some of the things that put us at a higher risk of feeling lonely, but specifically retirement in older adults, the death of a loved one or a friend, physical barriers, and medical problems, both physical and mental. So what are some interventions we can do Spiritual organizations are really kind of one thing that can help provide you with a sense of community, and also for some people can provide connections that they're looking for. Healthy behaviors, so exercising. You don't have to go to hot core power yoga with all the millennials, but even just kind of deep breathing exercises that you can do sitting alone on your sofa in a few minutes at home. Food and alcohol intake, so as doctors we preach all the time about eating healthy and drinking less alcohol, but it turns out that both of these are linked also with improved loneliness.
Say that again?
Eating healthy and decreasing alcohol intake can help improve loneliness.
But
The last part.
yeah, then you said something like, but that doesn't necessarily, I don't know what it was. It sounded like it was the opposite of what you were saying, food and alcohol intake, but that's okay.
So by improving loneliness, we need to become less lonely. That might be some language.
Cutting back.
Oh, cutting, oh,
So eating healthier, cutting back on alcohol
No, that's
could lead you to become less lonely.
oh, yeah.
Exactly.
Does that make sense? Okay.
There's a lot of increase, decrease.
Yeah. And like I mentioned, active relaxation and stress reduction techniques can be helpful.
But isn't alcohol, for some people, the one thing that helps them not be stressed out?
Yeah. So we know that alcohol might help you feel a little less stressed, but the flip side of that is that we also know that alcohol is naturally a downer, and so can also lead to feeling, in the short term it might make you feel a little mellow or calm, but especially long term and large amounts of alcohol can really end up being a downer and really worsen your mood long term, although it may provide a little bit of short term benefit. Plus all the other health effects that come with it that we won't go into now. Yes?
Also, maybe, I think there's a difference between, say, if you drink alone, and say you go out and drink wine with friends or people, that's a difference. Because then it's a social thing. That's a dangerous slope when you start drinking and start feeling sorry for yourself. I think you self-pity the other thing. It's really rough, and it's hard to get out of self-pity. And so drinking, seniors kind of, at the senior center that I volunteer at, but drinking with friends is something that came up a lot, how that can be very, very beneficial.
Mm-hmm. And again, I think it's more of that social interaction may be more beneficial than the alcohol that you drink with the friends. And then one thing that was repeated in many studies was really finding something meaningful and making a habit of it. So finding something about which you are passionate and finding a way to incorporate that into your life once a week, whether it be volunteering at a community center, volunteering at a pet center, really anything, whatever gives you meaning and joy, and just building that into your daily routine, weekly routine. So this is a link to a bunch of different mindfulness apps that I'll come back to at the end if that's okay if we have time, but there's an app for everything now, and so there are a bunch of different mindfulness, breathing, relaxation apps that can help you just kind of come back into a calmer, kind of more collected state. And then increasing your social network. So we talked about different ways to do that. So today we have technology which can really help people who don't want to leave the house, or if it's freezing outside, or if you're physically unable to leave the house, if you have access to a phone, a computer, a tablet, there are ways to increase your social network, such as calling friends, texting, emailing, and social media now today is a much bigger landscape of connecting with people who may be across the world.
Yeah, but if you're lonely and you get on social media and you don't get the likes that you anticipated or the validation that you're looking for,
Right.
that kind of adds to the loneliness.
And that is exactly the flip side that I was about to bring up, that there are studies that show that people who spend more time on social media actually feel more lonely.
Yeah.
Because you're looking at pictures of everyone else taking these great vacations with all their friends, and you're sitting at home. Yeah. So it's a double-edged sword, and I think, again, it's just kind of figuring out what helps you in that moment, and it can change. One day it may help you, the next day it may
I
not.
take maybe 2 months off social media to collect my take back my life. Because you get too involved sometimes. It's like you get like when I don't get a like that I think I need to get, you get you feel some kind of way like you reject me too. Rejection plays a lot into my loneliness. Well, it used to play a big deal in my loneliness. Just being rejected. Yeah.
One of the social networks is taking off that stuff. They're saying they're not showing the likes and not likes because it's creating problems for a lot of people that want that they're on there for that validation, so they're not showing it.
Yeah, but the comments is just as bad too, sir. The comments is horrible.
Comments.
Well, they may be for you, but I mean, I'm not on it.
So if you don't like technology and social media, you can also increase your social network in person. Whether it's visiting with friends, going for walks with friends, eating meals, or having drinks with friends. There are lots of different ways to kind of get yourself out there and hopefully establish those connections that can help you feel less lonely. Any sort of activity, really. The benefits of a strong social network have been extensively proven, and they include but are not limited to better health outcomes. Reduced risk of functional decline. Again, in older adults, this is something that we think about all the time. As we get older, our bodies get more kind of wear and tear on them, and we may be able to do less functionally. And studies have shown that people with stronger social support systems have that functional decline more slowly than others. We also will have an increased likelihood of functional recovery. So say you fall and have a hip fracture and have to go into the hospital and have a hip replacement, people tend to do better functionally afterwards if they have a good social support system. It can buffer the impact of negative life events. So if you have something bad that happens, whether it be the death of a loved one or the loss of a job or anything traumatic in your life, having that connection with people can help decrease the negative emotions that at some point we're probably bound to face in life. And then it also helps us have stronger self-efficacy beliefs and improve self-esteem. Really having those connections with other people helps us not only feel connected to others, but really feel better about ourselves. And I think kind of the bottom line is that there's a reduced mortality risk. So people who feel connected and less lonely are living longer. I put this slide here just to kind of recap. I know we covered a lot, and specifically loneliness in regards to lack of companionship and social isolation and how it affects not only our lifestyle, but also our physical and mental health. And really, social connection and that lack of loneliness seems to be a key point in improving all of these areas in our lives. Any questions? So this is a chicken on 3 little puppies. She's got a strong social support system.
I have all of those risk factors, every single one. And I work really hard to get out and do things. Some things slip away, sometimes I find new things. But I'm always working because I know that I feel better when I'm out doing things than when I'm with people. Yesterday, because of the weather, I stayed home and I was miserable. So.
And I think it's not only recognizing what makes you feel better, but also kind of forcing yourself to do those things and to build it into a routine.
Frank, if you don't mind asking, are there certain things that you have found helpful to kind of motivate yourself to find things to do?
I have to focus and make a plan to do them, and then I do them. like going to an AA meeting, walking in the park, going to therapy, going to see a movie, going to the library, all this stuff. I focus and I make a plan and I do it, and then I execute it and do it. So it's
So being very intentional and sort of making the plans for the things that you're going to do.
And it sounds like that's part of your routine now.
yeah.
That's great.
Question.
We'll do come here and then loop around. Okay.
Okay, you have like the little pet things in between. Has there been any like research done on the effect of if someone is feeling isolated and lonely, them getting a pet, which also helps them to then create more human bonds?
So I don't know specifically about if having a pet will help you create more human bonds, but I do know that links and connections with pets are almost, if just not as important as those with people. Pets provide a great amount of support and fun and joy in people's lives, so it's definitely something I would encourage.
I know there is research, and again, not specific to loneliness, but that having a pet does can increase someone's sort of sense of self, sort of your self-worth, having that responsibility for another living thing that looks up to you and loves you and unconditionally. There are also some physical health effects. If you have a dog, you need to get out and walk. Just being able to have sort of that, or a cat that's going to make sure that you get up at the time and don't stay in bed all day. So that I have seen some research on that.
Even taking care of plants. So
Yeah.
so it doesn't have to be necessarily an animal, but even taking care of plants that help people have a sense of meaning and purpose.
It's about pets.
Okay.
We all really clung on to the animal
Yeah.
picture.
I'm not sure, I think that they're very helpful for feeling not alone, but I don't know that it helps the loneliness. I think it keeps you company, but it doesn't necessarily do the other part, which is okay too.
I think that speaks to the just having people or animals around you doesn't always give you that significant connection that we talked about. Yes.
There is if you get a dog, say, go out to Rittenhouse, there's a whole group of different people, dog lovers, you immediately connect with other dogs. It's almost, if you go out to Rittenhouse Square and just see people who would talk to each other, that don't communicate on a regular basis, you get a dog and that's your entry in, because people are going to come up and say, what a cute dog, and you get to meet other people and talk to other people. And this is therapeutic because if people are, you kind of say you go along and and people don't talk to you, this kind of thing. Immediately dog lovers have a whole new, they're in a different world and a different communication thing. And you see just lonely people are ordinarily lonely, but they got a dog, and that's your intro into the dog world. It's a separate world that it's unlike almost any other thing that I see. And, depends on the dog too. A French bulldog, I guarantee you, is the most amazing dog. I would give you that. Just because of they're amenable and they almost lead you to other people who are dog lovers are a whole different breed of.
I was just going to comment on that because now on TV, all the commercials have dogs in them. They've got dogs in cars and dogs jumping off things, and they're doing everything. Dogs. People are really crazy about dogs. And I've been in the square like, if you better not have a puppy. You have a little puppy in the square, it takes you a week to get around.
Every kid,
everybody stops it, they want to pet it. So anyway.
Well, thank you all again for coming out in the cold. Let us know.